Good morning, everybody, and thank you for joining. My name is Jenna Sistad with the Ocean Monmouth Health Alliance, joined here by my colleague Angie Jean Bart. She's our bilingual community health worker, and we just want to take this time to welcome you all for joining this webinar series. It's called Our Health to Hold, and every month we highlight a new community partner and they take us through some of the programs and services that they offer, as well as do an educational component based on whatever health awareness month that it is. So this month is June and it's Men's Health Awareness Month, and we have Patty Thomas and Mary Beth Sheehan from the Monmouth County Health Department joining us to do a presentation. So we thank you for joining and we ask that you stay muted. There will be time for Q&A at the end. And in the meantime, if you could put your name and contact information into the chat box, that would be greatly appreciated. So welcome, and I'm going to turn it over to Patty and Mary Beth. Thank you.
Hi, thanks, Jenna. I'm Patty Thomas. Like Jenna said, I'm one of the public health nurses here at Monmouth County Health Department. And this is Mary Beth. She's also an RN with the Monmouth County Health Department. Her focus is mainly on the children's vaccine clinic. And my focus has been on the STIs, testing for STIs and adult vaccines.
Good morning, everybody.
Good advance. Go ahead, Jenna. Oh, sorry, you did. This is just our mission statement. It is probably similar to other health departments. We monitor the health status and check for community health problems. We do investigations. We do a lot of informational and educational programs. We mobilize with community partners like the VNA, other health departments, things like COVID and monkeypox and influenza. We develop policies and plans. We enforce laws and regulations related to food service regulations, school audits for vaccinations, different things like that. So this is just our mission statement, and you could advance that. We don't have to read all of that. So some of you may not know this, but Monmouth County Health Department does not cover every single town in Monmouth County. There are a few other health departments. Freehold has their own health department, and they cover Tinton Falls and Wall and Manalapan, I believe. We cover a majority of the towns in Monmouth County, and I think I'm missing Red Bank on this list here. We cover about 35 of the 50 or so towns in Monmouth County. Next slide. So just to briefly go over the different divisions we have here at the health department, we have the Environmental Services Division, or also called Hazardous Materials. They deal with things like noise and air pollution, hazardous material response if there was a fire, or a car accident, or a gas leak, or a tanker truck overturned. They also deal with the solid waste reinforcement management and water pollution control. Every Monday in the summer, starting Memorial Day, they'll go out and they'll check all the public waters to make sure they're safe for swimming. Next slide, please. We also have Consumer Public Health Services. This is our REHS's, which stands for, what's that stand for again?
Health inspectors, basically.
So they go to all of the restaurants, they'll go to any events that are like pop-up events or community events. They'll go to check the sewers, they'll do rabies control, septic systems, and well inspections. So those are some of the things that they do. Next slide. And what we do here in the clinical health department is preventive and health services. So we have a nurse that does child-led poisoning. She investigates all the cases that are above 5 units per
Deciliter.
And they're probably going to be changing that where they're gonna drop the level down to 3.5. So they'll, not necessarily have to have a visit from the nurse, but a parent will be contacted for any level that's 3.5 to 5, just to make them aware that the lead is elevated and steps they can do to mitigate that. We also have the children and adults immunization clinic. We deal with sexually transmitted diseases, and we also have a tuberculosis program here at the Monmouth County Health Department. Next slide. We have a team of communicable disease investigators, so they'll get notified if there's an outbreak or a communicable disease that's come up. We've been seeing a lot of different things lately. We've seen about 3 meningitis cases over the past month, a number of measles case scares. I don't think they were actually measles cases, not here anyways. So they'll evaluate and implement strategies to mitigate any communicable diseases. They'll get in contact with any potential contacts, and they'll talk to the case themselves to make sure that they know what they need to do in terms of isolation. Next slide, please. And we also have an emergency preparedness network going. So we're always training and preparing for a potential emergency. The most recent one was the Sandy superstorm, where we set up a medical needs shelter. So being that it's hurricane season, we're making sure that all our equipment and everything we need is prepared in case we have to set up a shelter for something like that. And last but not least, I think the mosquito division there in Tinton Falls, they do tick identification. They monitor for mosquito-borne illnesses like West Nile, Zika. They'll go out and they'll test different bodies of water. If they do find a mosquito that carries one of these diseases, they'll get in contact with the community to try to kill the mosquito larvae in that area. Next slide, please. So what we do here with our clinical and preventive health services, sometimes it relates to the general population. The most common one that you could relate to is the COVID pandemic response. So everybody that wanted a vaccine at the time when the vaccine became available was offered a vaccine that was provided by the federal government. We also mostly service with our vaccine programs, the VFC, Vaccine for Children program, and Vaccine for Adult programs, underserved areas. So these are people that either don't have insurance or don't have adequate insurance to cover vaccines, to make sure that they get all the vaccines that they need to protect themselves. And then some other things we do, sorry, just back up a little bit, one slide. Oh yeah, there it is. It's specific to the incident. So monkeypox 2 years ago just kind of came up out of the blue. And so we did get monkeypox vaccine, mpox vaccine, I should say, Jenios vaccine. And we did work closely with the VNA to make sure that certain target populations were able to get the vaccine. So that wasn't available to the general public initially, but we did target communities that might be more at risk because supply was limited at that time. And we also did get some polio vaccine in from the federal government due to a case that was of concern in Rockland County a couple of years ago. So anybody, an adult, which we never really carried polio vaccine for, needed vaccinating, we were able to vaccinate them. And then COVID went commercialized in October of 2023. So we weren't as involved with COVID vaccinations, but there were certain populations that were having difficulty getting the vaccine, namely children under 3, because pediatricians were not carrying the vaccine, and pharmacists that were doing a lot of the vaccinating for COVID are not allowed to vaccinate children under 3. So we try to pick up the slack there. Okay, next slide, please. So some of the vaccine for adults that we carry are COVID, influenza, HPV vaccine, hepatitis A, hepatitis B, MMR, Mpox, polio, and Tdap. So this is a little bit redundant, but the COVID vaccine was commercialized in fall. Monkeypox became available in July 2022. There have been a couple of outbreaks of monkeypox since the initial outbreak 2 years ago. So we continue to carry Jenios in case we need it for an outbreak, or anybody at this point that wants to get vaccinated, we will vaccinate them. Hepatitis A is also available, and that we use quite frequently for outbreaks. If there was a restaurant that had an outbreak of hepatitis A and some of the employees were not sure if they were ever vaccinated against hepatitis A, we will go out and vaccinate whoever feels they need to be vaccinated. If they were an exposure to hepatitis A and they get vaccinated within 14 days of the exposure, that will prevent them from getting hepatitis A. Okay. So why this is important for men's health, we feel that at the health department, there's a lot of things that we can help mitigate that are more prevalent in men, namely the HPV virus is more prevalent in men throughout their lifespan. There might be a period in women between a certain age group, sexually active, let's say between 18 and 40, where women and men have the same incidence of HPV, but throughout their lifespan, men are more likely to acquire HPV. Hepatitis B rates are higher in men than in women. Mpox is 93% higher in men than in women. Overdoses are more likely to occur in men than in women, 2 to 3 times more. And heterosexual men are less likely to get tested for STIs and more likely to have asymptomatic STIs. Next slide. So currently STIs are currently a big issue. You can see these numbers, these numbers are from 2016 to 2020. The rates have even gone up since then. So most of the STIs are on the increase. In this slide, chlamydia was pretty much level, but since then it's gone up slightly. Gonorrhea has gone up a lot, 22% in New Jersey from 2016 to 2020. Primary syphilis is really gone off the charts. And congenital syphilis, back in 2016, I don't think there was any cases in New Jersey of congenital syphilis. And in 2020, it was 24, and I think it's about double that right now. So in terms of STIs, there's 3 different types. There's bacterial, parasitic, and viral. 3 of the bacterial are chlamydia, gonorrhea, and syphilis. And then a parasitic would be considered pubic lice, scabies, or trichomoniasis. And then viral includes human papillomavirus, herpes, hepatitis, and HIV. What's important about all of the STIs also is that they're all very treatable, especially chlamydia, gonorrhea, and syphilis. But you have to know that you have the STI, and you have to know which kind of STI, so you know how to get it treated. These are just some rates of men versus women. For the chlamydia, the women tend to come up higher. Probably they think that's because more women are getting tested. And I did read that more women are getting tested. mainly because they'll go to their OBGYN and they'll find out that way. Gonorrhea, on the other hand, it's pretty even, men versus women. As some of you might be aware, there was a drug that came out to prevent people from getting HIV called PrEP. And they do think that maybe some of the rates of gonorrhea and syphilis are on the rise because PrEP is a medication that you can take to prevent you from getting HIV, but it's not going to prevent you from getting some of the other STIs. So that could be a reason for some of the increase in these numbers of gonorrhea and syphilis. Syphilis affected approximately 30,000 people in the U.S. It spread from direct contact with the chancre during sex. It can be spread also from an infected mother to her unborn baby. There's different stages of syphilis, and depending on your stage will determine what treatment or how many treatments you will need. So as you can see, primary and secondary syphilis, the rates are much greater compared to the other STIs between men and women. And this is just a slide. Oh, this shows the other number. So the other slide I had with congenital syphilis showed 2020 was 24, and in 2021 it was 48 cases. So I just wanted to focus a little bit on the human papillomavirus because it is more prevalent in men, and there is a vaccine that is available for HPV. The vaccine started in 2006. HPV is spread from skin-to-skin contact and through vaginal, anal, and oral sex. It's very common. Most sexually active men and women will get at least one type of HPV in their lives. Next slide, please. So just some information on the HPV vaccine. It's recommended for adolescents starting at age 11 or 12.
Yes.
It started in 2006. So my kids were born in 1996. They were gearing it towards women at the time, or girls at the time, I believe, but they did offer it to boys as well. And so I did get my children, my two boys, vaccinated pretty soon after the vaccine came out. It may be given starting at 9 years of age, and it's recommended for everyone through age 26. But just recently, a couple of years ago, they did increase the recommended age for sexually active adults from 27 to 45 years of age. It can also be given at the same time as other vaccines. Thank you. So some of the cancers that HPV infections can cause include cervical, vaginal, vulvar cancers in men, penile cancers in women, penile cancer in men, anal cancers in both men and women, and cancers, oral cancers, cancers of the tonsils, base of tongue, back of throat. Currently, HPV is second to tobacco in terms of cause of oropharyngeal cancer. So it's amazing that there is a vaccine available that can prevent cancer in people. I thought it was on a slide, but I don't see it here, but I did read that the HPV vaccine covers about 90% of the HPV viruses. There's different strains. So what our message is in terms of STIs is to make sure you get tested. Anyone age 15 through 64 should get tested for HIV at least once. People who have occasional exposures should get tested at least once a year. and people who are at high risk should get tested every 3 to 6 months. Syphilis, you should get tested, and if you're getting prenatal care, they will test you at least twice. Um, a, a man who has sex with other men, if you're having sex for drugs or money, if you have HIV or any other STD, or if you have sex with somebody who tested positive for syphilis. In terms of chlamydia and gonorrhea, age 24 or younger and having sex once every year, you should be tested. Age 25 and over, if you've had more than one sex partner or a new partner, you should get tested. And there are incubation periods with all the STDs. So if you had an exposure, you could get a test, but depending on which STI, you might want to wait a few weeks just to make sure. In terms of the services we provide here for men at the Monmouth County Health Department, we have free testing for chlamydia, gonorrhea, trichomoniasis, syphilis, HIV rapid test, and a hepatitis C rapid test. These are available to any man that's in our jurisdiction, and it's by appointment. If you were to come up positive through our testing services, we can provide treatment at no charge for chlamydia, gonorrhea, and syphilis. If you were to test positive through the HIV rapid test or hepatitis C rapid test, we would offer counseling and we would refer for further testing. In addition to the services we have here for appointment testing to our residents in our jurisdiction, we also work in collaboration with the clinic in Neptune, the Hackensack Meridian Jersey Shore University Medical Center, the A team there. We collaborate with them for a free walk-in clinic, which is every Thursday from 12 to 3 p.m. So they will test for all of the same things we test. They will not test for hepatitis C, however. But it is free to the residents in our jurisdictions. If you happen to be in one of the towns in Monmouth County out of the jurisdiction, there is a $30 fee. We also have available male condoms, so anybody that comes to our office and wants to utilize some free condoms, we have them available at no charge. Those are provided through the state. In addition, we just introduced a wellness transportation program in Monmouth County, and this is for everybody in Monmouth County, not just people in our jurisdictions. It's a free ride service, so you register within the county, and the ride will take you. You get 2 rides, 2 round trip rides a week, and it will take you to any medical visit, any visit to pick up pharmaceuticals, or any food needs. If you needed to go to a grocery store, we would take you to the grocery store. So that's something that's fairly new. They started in February, and it was a soft launch, and just in May it went countywide and was announced to the public. And another service that we offer, as I mentioned before, men are 2 to 3 times more likely to suffer from an overdose than women. So one of the services we offer is a program where we will provide you with free Narcan upon request. And if you're interested, we could do a presentation on recognizing the signs and symptoms of an opioid overdose, as well as naloxone use training. Is there any questions?
Thank you, Patty and Mary Beth. Thank you so much. I did see one question come through the chat. See if I can find that while I'm sharing the screen. I can't. I think it came from Jonathan. Jonathan, are you in a place where you can unmute and read the question?
Yes, can you hear me?
Yes. Oh, thank you so much.
So I asked, does oropharyngeal cancer include esophageal cancer? Is that like an umbrella term for anything throat related? Because I noticed through reading educational sources that esophageal cancer is on the rise in men most recently.
I don't really know the answer to that. I'm gonna have to look into it. I know they referenced like throat and tongue, but I didn't see specific to esophageal, so I can look into that myself and get back to you.
All right, thank you so much.
One time, a couple years ago, I had thought I had heard that HPV was a higher rate of oral cancer than even tobacco, but I was trying to do some research for this presentation and I didn't see anything to back that up, so I'm not sure if that's true or not, but I'd be
My
interested to find that out as well.
Yeah, it's definitely pretty cool, like to see like um, correlations made if like anyone's made any discoveries, which I was wondering like could someone have HPV and then all their lives, especially males, right? And then later on, it hit them as an esophageal cancer. Um, and them just being on the cusp of discovering that maybe there's a linkage, but we don't know because it's kind of new to everybody, like you were
But
saying.
kind of amazing that there is a vaccine that could prevent all these too. I
Yeah,
know Mary Beth, she administers the children's vaccines, and I know HPV is kind of a tough sell to parents sometimes because they have the daughter that's 11 or 12, and they really don't want to think about their daughters like being sexually active. So I know that's been an issue, that talking them into getting the HPV vaccine.
Most of the children that I see at the clinic are uninsured and they're refugees or immigrants. And most of them, the majority, are thankful when I offer them the HPV vaccine. They often come in the country with maybe some polio vaccines or Hep B's or DTaps, but I would say the vast majority, especially from Central and South America, they do not have a record of HPV vaccines. So I do vaccinate quite a bit of HPV to this group. They come to me because they need to get into school, and in order to get into school, they need vaccines. So I capture them as best I can.
And we do, I don't do a lot, but I do quite a few HPV vaccines. I see a lot of MSN men that want to get vaccinated for HPV, and it will help prevent cancer. And it wasn't available when they were younger, so it's nice that they have that option.
so even if I'm sorry, I had another question that I thought of, a follow up from what you're speaking about. Um, you said that now it's been approved for 27 to 45-year-olds to receive the HPV vaccination. So if a male is positive for HPV, can they still receive the vaccination in an effort to prevent further damages and the chance down the line of um, developing cancer from it?
Well, there's so many different strains. I don't know if it would reverse one that you already had. But since there's so many strains of HPV, um, it will help you prevent any of those strains.
Yes. Being positive for HPV does not preclude you from getting the vaccination. It's a discussion that you would have with your primary care doctor or the OBGYN.
Great, thank you for your input. I really appreciate all your um, information that you provided.
It is a 3-dose series when you're older than 15, I believe. And then younger than that, it's a 2-dose series.
Thank you, guys.
Okay, thank you.
Does anybody else have any other questions? You can feel free to put them in the chat box, or you can feel free to take yourself off mute and ask.
Okay, well, thank you, everybody. Appreciate your
I
time.
actually have a quick question. I'm sorry. I want to give everybody here the opportunity to ask first, but I wanted to know if you all had any programs or support services related to mold. Sometimes our coalition will be working with families and they'll talk about mold in their house or their workplace, and we often don't have a great answer for them or a resource to give them to.
I think our REHSs do get involved with that. I could find out for you and send you an email. Um, I know when people call about mold, I believe that they do have to direct them to the landlord, but I'm not really clear on how the process goes. We might have some influence on the landlord to do something, but I don't really know for sure with that.
Okay, thank you. That would be helpful. And then the other question I had was a renter, like a tenant landlord kind of question. Do you have any policies in place about safety, health safety, or overall safety related to overcrowding in homes in Monmouth County? Like you talked a little bit about communicable diseases before, and I know that that we see a rapid spread when we have so many families living in a 1-bedroom apartment, 2-bedroom apartment, things like that. And I just wondered about any input from the health department on that.
We do have a program called Healthy Homes, and they often go out and do presentations, and they probably address that. I know with TB, and we're the TB control for Monmouth County, overcrowding is definitely an issue, because if someone is carrying TB, they could spread it if they're infectious. So, but yeah, Healthy Homes is a good program.
I know in terms of when we go out on lead visits, a lot of times we'll find, multiple families, multiple people living in small areas. And I know our stance is not to get involved with that. We're not trying to displace people or get anybody in trouble. We have a hard time people complying with our services because they're afraid they're going to be found out that, they're an illegal immigrant. So on our end, as far as clinical services go, we stay away from getting involved with that overcrowding.
Okay. All right. Thank you. And then my final question is, you mentioned about the screening services and plenty of opportunities for people to come and make appointments with you all to get, testing and screenings. So how would they go about doing that? Who do they email or call to and ask for to make those appointments?
So if they wanted to make an appointment here at the Monmouth County Health Department, they could call the telephone number, and my extension is 7435. But they could just say at the basic number that they want to make an appointment for STI testing. And then if they wanted to go to the walk-in clinic in Neptune, that doesn't require an appointment, so they could just walk there, walk there, but they can just go there anytime between those hours.
Also, Jenna, there is an app that people have on their phone for the Monmouth County Health Department and the different services.
And they can make the appointments through the app.
No, they would have to call to make the appointment. Right. But the app, sometimes it'll have special messages, especially during COVID, where we were having pop-up clinics and the services that we offer.
Mm-hmm.
I see, informational. Okay. Like
Mhm.
communications from you guys or updates and whatever services you're offering. I see.
Correct.
Okay. Thank you. Thank you for answering. I just want to give everybody else one more opportunity and check the chat. Does anybody else have any questions for Mary Beth and or Patty?
I do, Jenna, if I could. Pete Curatolo, Ocean County
Hi,
Health.
Pete. Yes.
You know, and apologize for my late arrival at the meeting. I was on an environmental duties here at Ocean County Health Department. So I just texted John, our environmental health coordinator, and what he said was, with specific regard to mold, he said what our department does is it makes reservations on how to get rid of mold, whether it's through encapsulation or removal, and or getting rid of the moisture base that would cause it in the first place. But likely, in reference to one of the questions / comments a couple of minutes ago, that would be ending up in landlord-tenant court, as often as it might, and I think that it does. So that's what we have here.
Thank you. Yeah, probably similar here in Monmouth County.
Thank you.
Excellent. I love it. I love to see the communication between the health departments. Thank you. Thanks, Pete, for being here and for providing some insight there. Anybody else have any last comments or questions? Okay. All right. So what I'm going to do is I'm going to stop share and thank Patty and Mary Beth one last time. I'm also going to share the date for our next presentation for our Health to Hold series. It's going to be July 24th at 10 a.m. And we are going to be having the LBI Health Department talking to us a little bit about UV safety and some of the services that they all provide down south. You know, we're trying to be more present in Ocean County. Right now, we're looking to have a community health awareness event in collaboration with our partners at Horizon. And I did see Gina here at one point. We're looking for a place to host the last week of July to host an event. So if anybody is interested in collaborating, has an idea for an Ocean County location for us to host this, we would set it all up and break it all down and partner with you all to highlight the services that you are offering. So if anybody has any thoughts about that, please get in touch with me directly. And thank you so much for joining. We really appreciate your time. And thanks again, Patty and Mary Beth from the Monmouth County Health Department.
Take care.
Have a
Bye-bye.
great day, everyone. Bye-bye.
You too.
Bye-bye.